know nurses can enhance evidence-based practices to improve personal and professional growth?
I like to be educated, but I'm so frustrated. Hello to my loneliness.
Welcome to another episode of Caring Heart. I'm Benis Odudu. Here at Caring Heart, nurses learn the strategies to navigate the complexities of the healthcare system and break the barriers which limit them from succeeding. Practical tips not taught in the classrooms are shared weekly to help nurses build confidence, overcome cultural shock in the job, and advance their career. Are you still overwhelmed in your job? You are not alone. Countless nurses also feel the same. Do you know what? Complaining will take you nowhere. Some nurses are now saying no to overwhelm and compassion fatigue by finding ways to overcome issues such as improved quality of patient care and experience. Caring Heart is a channel I developed to do just that. I encourage you to check some of my episodes. There is no doubt you will find some tips that will be helpful to you. Today's episode is how a nurse can utilize evidence-based practice to improve the nursing career. Evidence-based practice is unveiling ways to integrate the best available research to clinical practice in patients' value. Evidence-based practice has continued to become a dominant theme in the healthcare system since it was first published in medicine in 1992. It was said to have been introduced by Gordon Goyette in 1990 in an unpublished work. Evidence-based practice have continued to improve patient-centered care approaches and help nurses find new ways to improve the way healthcare is delivered. Nursing research started with Florence Nightingale in her hygiene role during the Crimean War. She collected data to show how good hygiene prevented wounded soldiers from infection and death at a time technology was just starting to evolve. Nursing research and evidence-based practice gradually grew slowly but became popular in the late 19th century. With the growing public awareness and regulatory bodies focusing on outcome, it has further increased the need for researchers and evidence-based practice experts. Do you know nurses can enhance evidence-based practices to improve personal and professional growth? Increased demand for healthcare and patient awareness of their health conditions and knowing where and when to seek help, coupled with the regulatory bodies' oversight, have further opened up opportunities for researchers and evidence-based practice experts to find ways to better best practice. Nursing journals are on the increase, publishing research findings and proven evidence-based practices by academia and frontline nurses like you. Frontline nurses are more likely to know what works and what is not, and therefore are able to identify areas for improvement. Here are some practical tips to help enhance evidence-based practice. 1. Lifelong learning. It is important to stay updated with the latest research and clinical guidelines. This includes reading professional journals, attending conferences, webinars, in-person and online courses are also great ways to stay current with the latest evidence-based practices. 2. Research skills. Developing research skills to critically review research studies is a great way to understand research methodologies and statistics. It also enhances the ability to evaluate the quality of the study and apply the research findings in clinical settings. Just like Florence Nightingale in her hygiene role, participating in research workshops and courses on how to appraise research is a great way to hone research skills. I highly recommend frontline nurses to seize every opportunity. 3. Development and implementation. Nurses can develop and implement evidence-based practices in the clinical setting. Learning ways to evidence-based practice and implementing will certainly help in how care is delivered. As nurses, you are in a better position to do so by learning. 4. Pursuing nursing certification. Professional certification and specialization in areas of nursing you are interested in can boost your knowledge of evidence-based practices. Experts in many of these specialties often emphasize evidence-based practices. Therefore, becoming certified in a nursing area of your interest could hone your knowledge and help you learn from these experts. 5. Engaging in research. Engage in research in your institute. Doing so will help build your confidence and deepen your understanding of evidence-based practice. Keep finding ways to improve what is not working and quit complaining about things that do not work. 6. Advocacy. In policies, procedures, and guidelines in an organization, nurses are the largest group in the healthcare system, constituting about 30% of the healthcare workforce, according to the U.S. Bureau of Statistics. Therefore, joining your voices can certainly influence change. As the saying goes, there is strength in number. Taking leadership roles is a great way to help influence such changes. 7. Education and awareness. Evidence-based practice could be utilized to educate patients and to make them make informed decisions and advocate for them. Anytime you are providing patient education could be an opportunity to gather information, reflect on what works, and on how to improve patients' experience. 8. Reflection clinical experiences. Reflecting in clinical experiences and aligning them with current evidence-based practices is also a great way for self-improvement. Inquiry such as, why is this procedure done in such a way, could save some time and effort. Reflection could lead you to take action. 9. Networking avenue. Engaging in professional networking is another important way to meet experts, learn ways to integrate evidence-based practice in your practice area. I highly encourage you to align with people and things which inspires you. When you attend professional events, it will certainly blow your mind to see what peers are doing in other organizations. 10. Improve collaboration. Nurses can collaborate with interdisciplinary teams to focus on implementation of evidence-based practices. Studies have shown that collaboration is the most effective strategy to achieve success. Evidence-based practice highlights the significance of research in nursing. It's imperative to record the importance of integrating evidence-based practices into clinical decisions, making for improved patient outcome. Rapid changes in technology and patients' awareness of their health conditions have further increased the need for researchers. This is certainly an area for nurses who have a passion for research. You know what? Grants are being offered by government and nursing association to encourage more researchers. Seize this opportunity. I highly encourage you to participate in your unit and organizational improvement projects. If you discover that a system is not working, form a team and work together on how to utilize the best practice in research to make such changes. Complaining and doing nothing is not an option for today's world. Most professionals are searching for better, smarter, and user-friendly options for better outcome. Nurses must do the same. As a nurse, you can integrate these practical tips to help in research and evidence-based practice journey. If you like my channel, Give Caring Heart a thumbs up. If you are new to the channel, please subscribe and share. Thanks for watching. If you want more information, click the links below. And remember, Caring Heart makes a difference. Thank you. Bye.
I wish I knew.